Hey guys, it's Marshall and Mike with Physio, and today for the Mentoring Minute we're going to talk about Piriformis syndrome, also known as buttock pain with radiating leg pain. I want to give a shout out to one of my coworkers, Jason Tonley. He wrote an article that was published in JSPT that looked at a patient with Piriformis syndrome and maybe looking at a different way to treat it than the typical way. So the typical way for PT is thinking about a nerve entrapment related to maybe a stiffness or a shortness of a muscle. So soft tissue, stretching of the piriformis, nerve gliding to get the nerve to move better through it. And that works great on patients. He looked at it, well, how about if it's an over-lengthening problem? So they took a patient that had a 2-year history of buttock pain and leg pain and had him do a step down, looking at movement analysis, and the patient had femoral adduction, internal rotation, which also reproduced the patient's symptoms. So then when they put him on the table, they did an assessment and they found weakness in the hip abductors and the external rotators. Right, so what we're going to do is we're going to go through the progression that they went on for treatment to help improve hip abductor external rotation strength as well as motor control training. They didn't do any type of stretching, any type of nerve mobilizations. It was just working on improving the movement fault. And the nice thing was, after 8 visits, which was a course of 3 months, the patient had a perfect LAFS score, 80 out of 80, 0 out of 10 pain with all physical activities, as well as improved kinematics for femoral adduction interrotation, which is pretty important to say that the movement changed as well as the symptoms. So for phase 1 strengthening, weeks 0 to 4, they had the patient on the table doing 2 exercises. Let him doing a resisted clamps with a TheraBand around the legs. Go ahead and lift your knee up. Hold that, hold that. Make sure the pelvis is rolled forward. Good, hold it, and down. Good. So that was one of the exercises. The other one was a bridge. So go ahead and lie on your back. Good. Again, you have the TheraBand around, knees are bent. Good. All right. And push your knees apart and lift your hips in the air. Right. Try to squeeze from your glutes. And back down. Go up again. Hold that, hold that. Perfect. And down. Right. So for the first 4 weeks, focus on these 2 exercises on the table, then the progression. For phase 2 of strengthening, which was weeks 4 to 9, they had 4 exercises. They first started with just a squat with a TheraBand around the distal thighs. Good. They have them going in just 45-degree angles first. It's about right there. Hold that. Come back up. Good. Then progressing to a 75-degree angle. So go a little bit deeper on this next one. All right. Good. Hold that. Come back up. Good. Let's show a front view again. All right. And the emphasis was really on improving femoral adduction, internal rotation to make sure that knee is in line with the toe. Good. The second exercise was side steps. Again, starting that 45-degree hip angle. Let's go up a little bit. There you go. And going side to side. Good. Then just making sure that the trunk and the hips all kind of nice and stable. Good. The third exercise was sit to stand on one leg. So arms across your chest. Good. And then lift this leg in the air and go ahead and stand up from there. Good. And again, besides just getting stronger, we need to make sure they understand the control. So keep this leg out, trying to let your trunk lean over this way too much, so nice and straight. Lean forward, there you go, up and back down, keeping that out. One more time. Good, make sure you keep that knee out. Good. And the fourth exercise in phase 2 was the step down. So standing on the involved leg. Good. All right, again, we're making sure the knee doesn't dive in, and he really uses a good hip hinge. So he's gotta get that trunk forward and the butt out. Good. All right, and that's easier to see on a side view. All right, so as he goes to that step down, his trunk has to go more forward. So really stick your butt out. Good. Perfect. Let that go forward more. Let your trunk go forward more. So really hinge forward, hinge forward, hinge forward. There you go. Perfect. And then, so for phase 3, it's more of the functional activity and strengthening. So they had 4 exercises for this one, and again, it was weeks 9 to weeks 14. So the first one is just a forward lunge. So stepping forward with the involved leg. Good. Right. And you want to make sure they utilize the hip hinge. So trunk forward, good, knees, nice alignment. Good. Next one is a 45-degree lunge. So stepping more diagonal. Good. Again, get into that hip, so a little bit more of a trunk flexion. Beautiful. Good. Third one was a 2-legged jump and landing. So jumping off 2 legs, landing on 2 legs. Good. Really making sure you use a hip hinge. Knees stay apart. Do that one more time. Good. Good. Coming back. Next one would be 2 legs to 1 leg. Okay. And again, trying to control that femoral interrotation there. So do it again. Nice soft landing control. All right. this time don't jump as high. Try to do a smaller jump so you can control it. Perfect, good. So again, you might have to tailor how high they can jump to control the landing. Good. So in summary, besides the typical stretching, nerve gliding, to try to make room for the nerve, help the nerve feel nourished and get better movement, think about the movements that a patient does in the everyday that may be driving to irritation of that sciatic nerve through the piriformis as well. So continue to work on flexibility if needed, but also look at the way that they do a step down, look at the way they squat, and you can even look at the way they sit. Do they always cross their legs? When they sleep on their side, are they always crossing their legs? Because those can all contribute to overstretching of the muscles in the back of the hip, which then leads to insufficient strength. Thanks for joining, and hope to see you guys next time. Take care.